All right, I think that's all I have. My name is Kira. Most of you know that. I'm with the Gabriel Foundation, and today we are joined by Dr. Laura Wade. Yay! Thank you for hopping on with us today for your first webinar with TGF. We're so excited to have you.
You want me to start sharing my screen while we're talking?
Yeah, you're welcome to do that. And if Laura, if you would like to share a little bit about your practice and your work with avians, um, in the veterinary
Everybody seeing
world.
that okay?
Yes, yes, it looks like
Yeah,
it's going up
my
great.
audio's okay. You guys can hear me. Thank you so much for the invite. Um, this, opportunity is just really great, and I'm happy to come back to this topic. So I started looking into this in 2019, and I did present a little bit in 2021 at VMX. And so when Brenna Fitzgerald asked me to talk again, I said, well, I better review what's happened in the last 5 years, and a lot has happened. But I'm from Clarence, New York, and we are the opposite end of New York City. We're near Niagara Falls, Canada. And I grew up here. And I went to Cornell in for vet school and graduated in 97. And then I went on to do a residency at the Animal Medical Center in New York City. So I did end up getting to the other end of the state. And then I came back to Western New York, became board certified in avian practice. I've been doing that for 20 years. And in 2012, we jumped in and opened an all-exclusive exotics only practice. So we've been doing birds and bunnies and snakes, all that kind of stuff for close to 15 years now. So that's a little bit about me. And I have three Poicephalus parrots, so I'm kind of a poi nerd. But I love all parrots, but those are my guys.
What kind of Poicephalus do you have? I know you have a Myers in your
Yep.
mention.
That's Pepper. That's my vet school baby who's 31 this year. So, and I'm 54. So it's one of my longest relationships. And I have a female Myers. She's 23 this year. She was a SPCA special adoption. And then I have a Cape parrot who I think she's 18 this year. I haven't worked on a lot of capes in my career, but I actually have one. So they're just wonderful. So.
Well, are they in a separate area? A lot of people love to see a little guest appearance, but
I didn't bring them. I should have, but they all live in our bedroom. They're in a nice big bay window, side to side. They don't like each other directly, but they love to flock, do everything together as a flock separately. So,
that like the ambient socialization. I have a little Senegal, and he doesn't get along great with his brother, but he likes to be next to him. So,
yeah, firm
uh,
believer in cage by cage flock association.
all righty. Well, I think that we can go ahead and jump into it if you are all ready to go.
All right. Just wanted to say I don't have any financial interest in any of the products that I am going to talk about, although I do want to talk about them because people do want to know what do I use. But I'm not getting any money for it other than if I were to sell something in the clinic. And I do want to just mention, thank you, Gabriel Foundation. I don't know if a lot of you guys know, for, decades, Gabriel has brought birds to the AAV, Association of Avian Veterinarian Conference, to have new vets and vets unfamiliar with birds work with them and how to handle them and how to work with them. And so always in my mind at conferences, I see you guys and I just thank you for that effort. It's not easy flying all over with parrots and putting them up in hotels. So um, today's topics, we're going to talk about the history of CBD use kind of recently. We're going to talk about the legal landscape because that's certainly been changing. Pharmacologic properties and biologic responses in the body. And the research, we're going to talk about humans, especially because that's where a lot of it's happening, but also other pets. But I'm going to focus on birds. And as you see, this little hummingbird is actually feeding off of a hemp flower. I thought that was great, eating seeds or nectar or something from that. So birds are intimately related. We'll talk about some clinical cases, how to select safe and effective products, because this is a real biggie. And then our current dosing recommendations. And we'll have that Q&A. I think I also sent a 2-page handout of like all of our really important things that I want you to leave with. Some of it might be technical, but feel free to give to your veterinarian. I basically designed this for a pet owner who's known nothing about it to a veterinarian who's using CBD, and I hope everybody will get something out of it. And then I'll have some resources and references for you. So it all started in 2019. This CBD craze, you probably remember everywhere you looked, whether it was veterinary or on the bookshelf at the store, we just saw so much happening. And, the pet industry green paper in 2020, right after, thought that this was going to be a big deal. I tried to get information on 5 years later, and they have not released an update. But veterinarians were hesitant to talk about it. It was estimated like 50% of us didn't even want to talk about CBD back then because, ooh. But now we're more willing to do that. And so here's some more information about, what was being, used. So almost 3/4 of consumers are pet owners that use CBD, and 1/4 of the adults with dogs use products, half of them specifically for their pets. So it's big in people and in pets. So in the beginning, I'm one of those people, we have an integrative practice. We use herbal medicine, we use acupuncture, we use laser therapy, a lot of integration of Eastern Western medicine. And this is what I could find. It's on the floor of my office, not a lot of papers. There might have been a few papers on marijuana use in pigeons and rats from like the 70s and 80s, but I was specifically looking for CBD, and this was this slow start. But since then, we've had a lot of research. A lot of stuff is going on in Europe. They are a little bit ahead of us in their work, but this was what I looked on PubMed to try to figure out the last 5 years where things were happening. And you'll see, dogs are always leading. People are spending a little bit more on their dogs for research. And, you'll see the cats are down in here, and that is not unsurprisingly. But I did want to show you the birds. Bird research is not insignificant. 2020 and 2023 were the years of the parrot papers, and we're going to talk about that. But a lot of these in here were research on chickens, which is not a bad subject to study. So I just wanted you guys to see that it is definitely, we're only in the beginning of 2026, so don't worry. We'll get more as the year goes on. So what is the legality? It is complex, but we're going to just talk about each segment briefly. So federal, DEA, drug enforcement. 2018 was that pivotal year where hemp was removed from controlled substance, and it allowed these products to go across state lines. So there was really no restriction on the sale, transport, and possession as long as it's produced lawfully. And we'll cover what that means. Well, the FDA, the Food and Drug Administration, is also a federal organization, and they call this a drug, not a dietary supplement. So they say that it technically violates the FDA, but it's limited to manufacturers. The FDA allows states to pass legislation, and we'll talk about that in just a second. So there really is only one product approved by the FDA, and that's this one. And that one's a pharmaceutical grade. It's highly purified. It's, rigorously evaluated, and it was designed for seizures in little kids. And it's supposed to taste pretty good, but it is still a Schedule 5 controlled drug. But you might hear of that, and you might wonder what's available, but pretty expensive. So here's where the states come into play. So I'm in New York State, so I'll tell you what I know about New York State. It allows all this process to happen. as long as the THC content, and we'll talk about what that means, does not exceed 0.3%, which is kind of low. And it's legal if it's produced with that farm bill. It follows the federal and state regulations. There's a licensed grower, and you really can't claim to prevent, to diagnose, treat, or cure serious disease. So you can't have that on your bottle or your packaging. And it cannot be marketed as a dietary supplement. So a brief sidebar, there is marijuana-derived CBD, and that's extracted, and that's illegal at the federal level. There are some states with recreational marijuana programs, so there is a little distinction on that. I'm not going to really cover marijuana. I don't think it's appropriate for our avian patients because we get enough benefit from the CBD. So there is going to be some changes happening. I just wanted to cover that briefly. I know you guys are from all over the world and all over the states. So there are some new things happening in regard to some of the THC relative products. And they call this Continuing Appropriations Extension Act, and that's happening in November. So just be on the lookout for that. They're going to allow 0.4 milligrams of THC. I'm not sure how that's going to translate to the 0.3%, but we'll learn that as we go. And it's going to ban some of those really intoxicating components. And so that'll be coming up. So, CBD is fully legal in 23 states. Hemp derived, not marijuana derived. It's conditionally legal in several states. Okay. And it's strictly, you guys that are in Idaho, Kansas, and Nebraska, you guys are a little bit shafted on this. And so some states are a little bit slower to adopt, and they often will say 0% THC, which there are some products out there with that. So for you guys that want to check with your state, this will be kind of morphing over time as well. Colorado, you guys are in a good position. So you are one of the most progressive states. That's where the Gabriel Foundation is. And you can have both hemp-derived and marijuana-derived. So you permit the sale of hemp-derived CBD in food and beverages, and that's different. So yeah, good position.
Laura, I have a quick
Yeah.
that I do think would be helpful to answer now, before we go on. One question is, you're using the words hemp and CBD interchangeably. Are they the same thing?
You are at the right point in the presentation. Here we are on this slide. Yes. So I wanted to just introduce the legality, but now we're going to go into the weeds here. Oh my gosh, that was pretty funny. We're in the weeds here. What is the difference? Biochemically, there's a difference. Okay. You can kind of see this chemical structure here. Can you guys see my little pointer? Is that moving around in the slide there?
You can.
Yeah. Okay. So they're different chemically. And that's why the effects are seen differently. So you can just see this structure, how there's a little bit of a change. But it's the same plant. How is that possible? So when you think of dogs, dogs are the same species. How can you get a Great Dane and a little Chihuahua, a little Chihuahua, and they're both Canis lupus? There's a lot of genetic variation, right? And so same thing with cannabis sativa. So there are several different varieties. Even the leaves look different, the plants look different, and they are genetically altered because of their content. So sativa has high CBD, low THC. Indica has high THC, low CBD. And ruderalis is low THC, and many things in between. Okay, so kind of interesting how that works. Cannabis, so cannabis is the plant. And basically when we talk about hemp, we're talking about plants that favor the CBD. They have less than 0.3% THC, and that's what allows them to be legal at the federal level. And then we call marijuana the THC predominant strains, and you can see how much higher the THC is in that plant. So hemp or marijuana. Cannabis is both, but we are focusing today on the CBD hemp aspect. Does that answer the question a little bit better?
Yes, I think it does.
Okay. So same plant scientifically, but different legal definitions based on that THC content. So those are phytocannabinoids. Those are from the plant. But our body has endocannabinoids, chemicals in our body that act very similar in various organs. And I'm going to cover what that's all about. So there are receptors in our body, CBD1 or CB1 and CB2, that recognize the chemicals. THC turns into CBN, and then we have cannabidiol. And there's a lot more, but two receptors. The CB1s are mostly in the brain, central nervous system, and the CB2s are mostly in the peripheral organs, and especially the immune system. And this just shows you a little nerve ending and how the transfer of some of those chemicals go. Interestingly, CBD actually works as an antagonist. So if there's a toxicity, like in a dog that has eaten too much marijuana, you can actually give CBD to counteract that. A little fun tip. So we've really only known about the actual receptors since I was in high school. 1988, I was a junior in high school. And then we've learned a lot since then about all these different components. So it's relatively recent timing. And then this just shows you in a human where all those receptors are, and why we might have different effects from the different receptors. In the brain, CB1 receptors are in various locations. Cognitive function, appetite. You talk about when you're on a nice weed, you feel hungry and you just have all these enlightening experiences, right? Movement, you might be off balance on your movement. And all these things here, we'll talk about how that affects. So we call this the biome, the endocannabinoid biome. It's like the whole life structure. So we have receptors. We have internal things in our body, endocannabinoids. We have enzymes that break things apart. We have our GI tract that has its own life cycle and nervous system, and then additional components. So it's really, really complex. And I'm not going to cover this in detail, but the slide is just to show you it's not just the CBD. It's all these other factors that allow these things to work in different ways, and we can target that. What are the pharmaceutical effects? There's a lot of them. You can see a highlight of some of the ones here, but I'm going to cover the ones that in veterinary medicine, at least, we are really focusing on: inflammation, protection of the nervous system, relieving pain, and relieving anxiety. And I took a little bit of CBD this morning in preparation for this lecture, and I feel quite calm. So yes, I'm not only a prescriber, but I actually can verify that there are some good anxiety effects. So a lot of different therapeutic actions, a lot of different chemicals here. These aren't even all of them in the different aspects. So there's over 60 to 100 plant-based ones that we could tap into. There's additional terpenes and flavonoids, things that come with the plant that help its effectiveness. And they call that the entourage effect, the grouping of all those chemicals that help make the effect. This is a little technical, but there's other approaches to reducing pain. And all these inflammatory substances are in the nervous system, and targeting those rather than the receptors to reduce the uptake of all of the things in our body that are similar, increasing tissue levels of endocannabinoids. So a lot of research in alternative ways. So for those that are interested in some of that, you can look that one up. All right. So for our pets, a lot of the things that we're using were really extrapolated from our rodent research in humans. And the strategies really depend on the condition and the organ system. And these were from, those early years of what's available, peanut butter infused and chews and, oils, how to get your pets to take these things. Of course, this is for dogs. And then understanding that even though it's not labeled a drug, it has drug effects, right? And so if we're taking other drugs, here's some common ones that we might prescribe to a dog that are metabolized by the liver, that we might also be metabolizing and sharing space in that liver to do the metabolism. Actually, 60% of the drugs that are being used, prescribed, at least for people, could be affected by concurrent use of CBD. And so it's not willy-nilly to say, I'm going to just take this product. I should probably let my doctor know or let my veterinary know that I'm using this because it might affect how my animal, how my liver is using that drug. And then smoking and vaping, there's other ways of, besides ingestion, but we know that a lot of contaminants are in some of these products, and especially with birds, secondhand smoke just by itself, but then adding some of these other chemicals could potentially be not a good thing. Okay, so here's the research that's going on with people, and it's not a complete list, but if you look at all the different things that they're looking at, trying to find benefits for, kind of just look and see what are some analogs that we might use for our animals too. I'll give you guys just a second to read through that list. It's a good one. Probably anybody would have something on that list. I know I've got a couple. Okay, somebody you know. But the thing that I want everybody to remember, here's the things that it's the best for, at least that we know right now: pain, anxiety, inflammation, nausea, and seizures. So those are the things that most of us are using CBD for, and it's called pains. So it's an easy way to remember, pains, but that's what it means. So those are the areas that we're going to focus right now, that we have a lot of good documentation on. Want to cover dogs briefly because I want to show you the difference between dogs and birds. They have a higher concentration of those CB1 receptors in their brain and cerebellum than other species. They're lower tolerant for CBD, and they have a really dramatic response if they get a hold of somebody's gummies. And so veterinarians know this, and can also affect their liver in a higher level than some other species. Here's some studies that were done recently in the last couple years on some disorders that we know affect dogs, and especially with epilepsy. Dr. McGrath is at the University of Colorado and did her study there. Here's some more ongoing with dogs. Dr. Gamble is at the Cornell College of Veterinary Medicine, and their team has been doing some recent work as well on osteoarthritis in dogs. What do we know about cats? Forgotten pets. Cats are not always brought into the vet because they are hard to get to the vet. But there have been some dosing strategies and ongoing research, safety studies, pain management, behavior management for kitties. So those are the things we're looking at for those guys. Horses, new research going on for horses, stress, inflammation, anxiety, stereotypical like behaviors. So back in 2021, and people are asking me, what do we know about our exotic and bird species? Well, we didn't have a whole lot. Again, going back to the preclinical studies in those laboratory rodents and some rabbits with glaucoma, we didn't have a whole lot. I was starting to use it right away because I really felt that it had some merit. And some of the things that I saw early on in some of our patients were arthritis, neuropathic pain, and as assistance for some central nervous system signs such as seizures. And not to leave the bunnies and the guinea pigs out. So there have been some good papers coming out for those exotic mammal species with trying to figure out what's a good starting dose, what's a good, how long does it last in the body? What can we expect? Are there any side effects? So those are some great papers on those kiddos. But we're here for the birds. So I just wanted to cover some of those when you remember that timeline. Songbirds. Zebra finches are studied for their continuous brain reorganization. They learn songs every year. A lot of our songbirds do, and they can change. And I was fortunate in New York City, right down from the Animal Medical Center, was the Notabaum zebrafinch lab, where they were doing so much research. I actually got to meet some of the Notabaum finches while I was there. And so, isn't it interesting to see what would happen if there's some damage to the brain using CBD? So that is a wonderful look at that. And then our chickens here, trying to discover, what might be happening if we use that. I kind of was laughing and going, boy, I'd love to have CBD infused omelets in the morning. That would be wonderful. But just kind of a fun aside. So those are some of the things that are coming out when you're looking online. But these are my papers that I really want to focus on, the parrot papers. The first one came out, Carpenter's study with our Hispaniolan Amazons, and that one, we owe a lot to our Amazon parrots, our research colonies, both at LSU and other places that have, through the years, volunteered to help us understand how different drugs like meloxicam, fluconazole, how all those things work in parrots. And so I just give these guys a lot of credit for that. And then our orange wing Amazons over here, my favorite Amazon species, looking at how that would work. And so I want you just to look down here and just look at that dose. We're going to come back to that. 30 milligrams per kilogram is a dose that they have decided was pretty good in staying around the body, didn't have too many side effects, that kind of a thing. If you look back to this study, that's a pretty high dose that they determined, but they did not find that there was any problems with that. But I want to come back to that. Just keep those numbers in your head as we talk about dosing strategies for parrots. Okay. Let's cover some clinical cases. How am I doing on time? Okay. Big bird. So I want to introduce the Vermont Seabury Farm, one of our clients. We saw some of her ducks, and you can see there's one of her Kecky Campbell ducks here. And I bet you're wondering what those little plants are right there. I think Sean is joining us online as well, Sean and Bodie. So that's what seaberries look like. They are high in carotenoids, that's why they're orange, and omega fatty acids. And she also has a duck sanctuary. I think there were over 100 ducks that were dropped off about a decade ago. And the reason I got involved is a lot of these girls would have cystic reproductive disease, and Sean would drive from Vermont to see me to spay these little girls. So that's how we got connected. And so not only does she have a farm that has an integrated design with a farm cultural orchard, she also has a sanctuary, and that's really related. And she also produces CBD from all this, so that's really great. Sea buckthorn. All right, so how do the ducks get involved? These guys, they're out there, they are getting bugs, so they don't have to use pesticides. They're pooping as they go, so there's fertilizer, and they're digging in the soil and they're causing aeration of the soil. Interestingly, they do not eat the plants, which is great because, if your birds were eating your plants, you're not going to have much of a crop. So that's kind of a really neat, unique way to use the ducks on the farm. But I want to talk specifically about Pluto the duck, and that's Pluto's friend Uno, who came to me for a really sore leg. So we'll see if I can show. I don't think that's a video. Here's Pluto's swollen leg, his ankle joint or his hock joint. Here's a video of Pluto walking. Having a hard time keeping up with Uno. He's just really not wanting to put weight on that leg. Wagging his tail, though, giving it a good go. Here's the radiographs, the x-rays of the joint. And if you compare that with this other joint, which is actually pretty good, you can see the loss of cartilage just wearing away. And so we don't have proper cartilage there. So that really hurts. He's also got very large testicles because he's in breeding mode, and a little bit of grit in the gizzard. And then looking at this view too, I think you can tell that leg looks a lot different than that joint there. So we tried a number of different things. We used glucosamine and flax to try to see if we could get some joint cartilage back. We used turmeric for its anti-inflammatory properties. We were testing out the farm's CBD oil and also meloxicam. So a number of different things. I think we also used class 4 laser. And the doses that we were using at the time were 0.07 to 0.5 milligrams per kilogram. So kind of low if you remember back a couple slides ago to 30 milligrams per kilogram. So here's some updates. February. Can't tell which one's Pluto, which one's Uno. Here's another one. Maybe you guys can tell. Sean, you probably know. Amazing that they could get up on this hay with a leg like that. So this was one of those early cases that convinced me that this was probably a good thing to consider for our kiddos. And, Sean told me that these guys were, that we had Pluto on meds for several years. He's currently off of all meds, and there's no swelling, no mobility issues, no evidence of pain. So just to show you that you might not always be on medication forever with a leg that looks that bad. So really cool case. Thanks, Sean, for letting me share that. I want you guys to look at this video and just tell me what you think. Well, you can't tell me, but think about it.
You guys are welcome to put your thoughts in the chat as well.
So really off balance. We call that a dysmetric gait. Trying to walk, just really can't get a good forward motion. Yeah. So sort of reminds you of like a Parkinsonian movement, if you know someone with Parkinson's and how they move. So that's a central nervous system effect in what we'll see and how the body moves. So if anyone was thinking of avian bornovirus, ganglion neuritis, you were right. And unfortunately, this was way before we had access to CBD, 2015. But I remembered Paco and how the owners really worked on, we used Celebrex and Rabenocoxib, but we weren't able to ultimately resolve it. But I remembered back and saying, would have liked to have seen what CBD might have helped with Paco. So I just wanted to introduce that. As we talk about this condition that I think a lot of us have seen, there's a lot of common clinical presentations, stomach and gastrointestinal dysfunction, general neurologic dysfunction like Paco, feather destructive behavior in a lot of our parrots, and then combinations thereof of what we might see. But what is it really? So it's immune-mediated damage to the nerve ganglia, the heads of the nerves, by some of our own immune system, our lymphocytes, our plasma. I shouldn't say our, because it's not a people disease that we're talking about. It's a bird disease. But here we have a normal nerve, and you can kind of see this nerve right here with a pathology section. And here is the same nerve ganglia with the lymphocyte inflammation. And I don't know if you guys can see that darker color, those more intense blue cells. Those are lymphocytes and plasma cells that are in that nerve causing damage. And that disrupts the flow of energy from the brain to the nerves, or from the head of the nerve to the end of the nerve. And that's why we see. Now, it could be anywhere from the heart, the pacemaker of the heart, to the sciatic nerve, just one. It can be segmental, it can be diffuse. And so currently, a lot of our treatment has been to reduce that neural inflammation. And a lot of us are using Celebrex. Robenacoxib is the injectable form. It reduces the infiltration of lymphocytes, especially in the nervous tissue, and it reduces these things called pro-inflammatory cytokines, things that are released by the body in response to inflammation. So I'm highlighting this in blue because I want you to just keep that in your memory. We're going to come back to that in another way. So CBD is an immune modulator. It does have effects in other immune-mediated diseases. It suppresses lymphocyte proliferation and limits the infiltration of those cells. And it reduces those pro-inflammatory cytokines. So very similar to some of our non-steroidal anti-inflammatories. Affects scavenging function of some of our macrophage cells. A couple more cases. This is Bonsai, our little Patagonian conure, who's a wonderful patient, very clever, smart little bird. But Bonsai came to me with ventricular dysfunction as a young bird. Been seeing him for a long time. He kind of got through that, but he was positive on Bornavirus DNA, and he did respond to Celebrex. But he had these unusual fasciculations or tremors of his pectoral muscle, and I'm going to show you a video in just a second. Later on, we did find out that he did make antibodies to his ganglia, to his nerves, which is often very associated with Bornavirus. And then he kind of didn't improve with Celebrex and gabapentin, so for those fasciculations, but we thought, well, this was something to try with CBD. Kind of a lower dose, 1 mg per kg, some improvement within a week. Well, fast forward several years later, he is off of CBD. He is stable. We've just shifted a little bit with robenacoxib and Lupron, which is a hormone. He does have some hormonal issues. So just to show you that sometimes we will use it and it'll go away, and we'll use it again, and we'll try different drugs as co-drugs. So he's sideways, but I want you to see these small tremors that you can see the feathers shaking a little bit. See those little tremors? And I think there were times too where he was anxious. He had bubbles in his poop. He was biting at his feet and having other manifestations of neurologic inflammation. We did have him on the CBD, anywhere from 0.5 to 1.5 mg per kg twice a day. But currently he's not on it, but it did help. Thanks, Bonsai. Bien, he speaks Spanish. This is Sammy. And Sammy was a 2-year-old African gray at the time that I met her. She presented for feather chewing and plucking, anxious behaviors as well. She was positive for Bornavirus and anti-ganglioside antibody. And we tried her on a lower dose of CBD 2 to 3 times a day. And within 30 days, which is sort of like my time period, let's just give it a couple weeks, see how things go. And she did have some improvement. Now we are on a much higher dose. We're actually on a different product. She's also on Celebrex as well. And I just talked with her recently. She liked the flavor of the other medication that we had around the other product, but that she feels that this product, we're going to cover this one in a short while, is working really well. We often will use it for travel nausea too at a higher dose, and I think that helps Sammy. So, I want to talk about the skin and how it might relate to feather picking. Our skin is a barrier. There's also a lot of neuroimmunoendocrine functions and why things might work, at that level. So, our skin cells have a lot of different functions. We have a lot of those CB receptors in our skin, believe it or not. And what would be some problems with that? Here's some just thing. Oops, let me go back. Sorry about that. Take a quick look at that. Okay. So very busy diagram, but just to show you, we have a hair cell, we have our immune cells, sweat glands. Birds don't have sweat glands, but mammals do. Sensory nerves. And then we have our endocannabinoids, our own chemicals. Okay. And there has been a lot of research coming out on using topical CBD in treatment of the skin, not only taking it orally and having those effects, but could we do something at that level? Not a lot of papers, certainly no papers that I know of yet in birds. We're found a product that doesn't have a lot of menthol and eucalyptus and tea tree oil that would be toxic to birds, that we're going to do a early clinical trial with some targeted uses for skin lesions in birds. So look for more of that down the line. So wanted to cover about how we pick CBD, and it's a wild west out there. You could go to the corner store and there's CBD products. You could go, a lot of different places. And how do you know what's good? So a lot of these products, even online, they're either over labeled or not the right potency. Some are under labeled or accurately labeled. And this was back in 2017. It's getting better. A lot of them had heavy metal. Why would they have heavy metal? Because hemp is used to absorb toxins from the ground. It's one of those plants that cleans up pesticides and toxic spills. And so it's very good at that. So what I like to look for when I'm selecting a product is, does that company do independent, not associated with them, third-party testing? Take a little bit of the product and check it out. Every batch would be great, but at least often enough to know that you're being consistent. Verify the purity of your components, what your ingredients are. Screen for pesticides if you can, solvents, which is like industrial waste, microbes, heavy metals, THC. And favoring U.S., for those of us in the U.S., we should, favor U.S. derived hemp, at least when I was preparing this talk several years ago, higher cultivation and soil standards. You could argue maybe the Europeans are ahead of us on that. Register with the state. I like to use organically grown, non-genetically modified product. Good manufacturing process called GMP, that they do a lot of things to make sure that their products are safe. Maybe they're using CO2 extractions as opposed to organic solvents. We just talked about not having solvents. And then maybe they would be broad or full spectrum with clear dosing labels. QR codes, certificate of analysis. So I've got a bunch of things to show you. Here's were some of the early ones that we were using, some pet products. And you can see that label says it's organically grown. That's cool. That label says it's the National Animal Supplement Council rating, and I like looking for that on the products that I use. A lot of people products. Here's one that takes you to third-party test results. You can scan that and go right to the test result. And then here's a product from Oregon that has individual batch test results and THC content and CBD content there. So those are things to look for. You want to see a lot of that on your products. So this was Show Farms CBD testing. And you can see right here, letting you know there's CBD in there, letting you know where the THC is. And okay, and this was the product that we were using at the time. All the different CBDs that are in there. And every product is different. Okay. So what do we do here? I'm just going to highlight what we're using right now. Again, not because I'm getting any kickback, but I've looked at these products. So these are the two that we're using right now. And I'm going to just talk about them, why we use them. They're domestically grown. They're veterinary products. They have the NASC. The Hemp RX is a 15 mg per mil. There is 0 THC. It's from Colorado. Um, it shows that there is an expiration and a number that you can go and see what they are looking for. I think we have cannabinoids, we have heavy metal testing, pesticides, and solvents. So that one is very complex, very comprehensive, and that's what that particular batch is showing. So I like seeing that. I like to have my clients looking for that. So it is pretty high on the CBD. There is a little something else called CBDV. We'll talk about that in just a second. But they're basically formulated for dogs and cats as oils or chews, broad spectrum. They have all the other terpenes and flavonoids in there. What is CBDV? It's a minor cannabinoid. I thought it was interesting because the other products don't have it. And it's studied for its treatment of epilepsy and autism and seizures. So might be more research coming down the line of products using that for those. So interesting. Just thought I'd point that out. Little chemical structure difference. Okay, Elevette is another product that we're using, really high concentration, 70 milligram per mil, and that's one of the uses for birds as we're going to talk about our dosing, why this is helpful. Qualifies with the THC. This one is grown and manufactured in Maine. And I have an expiration and a QR code, and this is what I get from them, a list of ingredients. Not as comprehensive as the other product, but it's good. And this was the product that was used in the parrot papers. They used a little higher concentration, 100 milligrams per mil, but they actually used this product in their study. So it's 50-50 CBD and CBDA. And you're going to ask me, what's that? So we'll talk about that in just a second. Full spectrum, which includes all those phytocannabinoids, terpenes, and flavonoids. Right now, there's formulations for dogs, cats, and horses. Carrot pellets. I thought that was great, that you can get something to a horse. Right now, we have found that the oils are the best for the birds. I thought about trying the chews. We couldn't get the right dosing and the cost down, and even the paste. Just we tried it, but just couldn't really make it work. So we're talking about the oil here for the Elevette product. So CBDA is cannabidiolic acid. It's a precursor to CBD, and it improves the absorption and retention 5 to 10 times better. So you get more bang for your buck. It's also 100 times more potent, more rapid absorption. And it has better anti-inflammatory effects than CBD, so more effective for pain, nausea, and there's those COX-2 enzymes that we talked about, very similar to Celebrex. Serotonin is part of our brain chemicals that helps us with anxiety and feeling of calm. So current dosing recommendations, and we're coming up to the hour, but this slide is super, super important. These are some of the folks that are doing a lot of the active research. This Higuereta that's one of the parrot papers, so I want to highlight that one. But in mammals, for you veterinarians out there, this is kind of the current thoughts right now for arthritis, for seizures, for blocking the effects of THC, and for anxiety. And what you'll notice is there's different doses for different treatment options. Higher doses for anxiety than arthritis, and kind of moderate doses for seizures. And then for anxiety, like if you wanted to use that for your pet coming into the vet or going travel, give it a little bit of time to get absorbed. And depending on your product, the absorption might be different. Here's the birds. So I'm using anywhere between 15 to 30. 30 is the parrot study. And I have a couple patients that we are going to kind of transition up to that, but much, much higher. than the mammal doses. I think when I look back and I say, well, some of the cases that I used early on, the effect wasn't so great, or maybe it was great. I was using, remember those doses, zero point 0.1 to zero point 0.5, maybe 5 mg per kg. Still had some effect in a lot of patients, but I'm wondering now if going back using higher doses, now that we know more, would be more effective. 120 mg per kg is going to be hard. I think I dosed this out, cockatiel, using that 30 mg per kg dose for that Elevet product would be about 4 units, 0.04 mil, which is about a drop. Easy peasy, can take that dose. Where some of the lower milligram per mil, it's going to be a higher dose. That would be like 0.1 to 0.2. Sometimes it's hard to get a cockatiel to take a dose that big. So all those factors are in play of what dose, what's our concentration, what's the taste, are they even going to taste it? So that's what I want you to remember for your birds. And better absorption with food. It's oil-based, and you want to have a little bit of food in there, would be helpful. But we're going to probably need to do some dose adjustments because we start off, and maybe if I'm a little nervous, the bird's on multiple medications, I might start off lower to help that liver, work on things. Try it. Okay, a couple days, a week, 2 weeks, we can always increase the dose. We can always try a little bit higher. And so the biggest side effects are going to be sedation and calmness. And so Sammy's owner just talked with me last night. She's saying that Sammy seems so calm and so relaxed. And I didn't realize how much anxiety she had because, now she's acting like a normal bird. So you can increase the dose over time. You can always go back, but that's a good tip. And if the bird's going to be on it long term, or if they're on multiple medications, I would definitely be checking liver. In the dogs, we're checking ALT. In birds, we're checking AST. We're checking bile acids, those types of chemical analytes. References, I didn't mention, I read a bunch of books. I went out there and I just looked at a whole bunch of stuff. If you wanted to pick one to read, I would do this, Leinau and Birnbaum, obviously talking mostly for humans, but a lot of coverage on the different uses of CBD. The pot one is mostly marijuana, but I have those references for you. I took a lot of lecture webinars as much as I could in the early days. Robert Silver was the very first one that I met right before the Farm Bill. And I sat in the lecture and I said, this is great science. This is really good backup that you're presenting. And that's the product for RX Vitamins. Stephanie McGrath, as I mentioned before, did a lot of those early papers with dogs and presented. And then Josh Shoshnow, even recently, has been presenting at VMX and other sources on his work. And if you want to learn more, this is a really good membership. I think it's $70 a year, and you can get all sorts of different reviews on different things, omega fatty acids. This was like a 30-page review on CBD oils, independent testing. Not everything's on there, but some good information on that. Project CBD is a nonprofit organization that does a lot of compilation of research and information for just basically anybody. And they've been around since 2010. I don't think this one's on your notes, guys. I added this one this morning. So if you want to quick write this one down, it's a good one. I keep finding stuff. This thing can go on, but I got to try to keep it under an hour. And I hope this has been inspiring for you guys. Veterinary Cannabis Society of Veterinarians, this is a really great organization if you want to join and learn more. This one's on your notes. You can be a member and kind of get on the in. If you're a member of VIN, you can take a course. This one looks great, 6 hours by a group of people. Jeff Pollard is a friend of mine who's board certified in dog and cat, but that's working a lot in the last 5 years with CBD. And it looks like a good lineup, only $140. If you need CE and you want to learn more, take this course, vets and vet techs, I think, as well. And that's me. And I think I just heard the cuckoo clock downstairs cuckooing. I can't believe it. I got all done. But that's where you can contact me if you have questions beyond here as well. So.
Awesome. Well, thank you so much, Laura. That was an incredible presentation. We have a lot of questions, and so I
Figured.
yes. One of the things is I think that it is kind of like a new and budding product that we're using. And I do think that it kind of gets stigmatized sometimes because of the association with marijuana and THC. And so people are not super sure about it. And I think we have some really good questions in here that we can dive into and just get a little bit more information about. Let's see. Let me see if I can find a good place to start with our questions. Hmm. Okay. So we've had some questions about CBD being used to help ABV positive birds, which we discussed, and AGN. So it says, is CBD being used for parrots that have suffered possible brain damage from severe seizures and stroke? And we did see that. Who was the Amazon that we saw?
Paco didn't get the chance. Paco had born a virus, but that was in 2015. So I showed him because I wanted to show what does the disease look like as its severe form and to introduce born a virus. But yes, I do use that. If other veterinarians are out there want to comment, there's not a whole lot of clinical studies yet, and that's what I'm hoping that some of these universities and these collections of birds that there might be. Now that we kind of know what doses to use, we may still not be done with the ideal dose, but at least we are so much closer. And I think somebody will beyond me. Well, I'm still using it in practice and I'm still reporting on it and I'm still talking to veterinarians about it, but we need a clinical trial, I think. Celebrex versus CBD or the combination of. Um, yeah, and a lot of those birds, would have to be followed over time too, because it's some of these guys, maintain the disease for a while. So yeah, hope that answers that question. But yes.
Yeah, some follow-up there. With ABV and with AGN, kind of what we were looking at was it looked like there was a lot of that lymphocyte proliferation. And is that what is causing the nerve dysfunction itself and the pain that's associated with that?
Yes. So the virus itself causes the body to say, we don't like you here. And that's we have to calm down is that inflammation, not the virus. The body has to get rid of the virus at some point. And some birds will recover fully. Some birds will calm down for a period of time and then reactivate, especially during periods of stress, like these girls that are egg laying, or somebody's traveling across country and the bird is super stressed and it can kind of reactivate. So various presentations, various progressions, not one case is like the other. And that's what makes it really challenging to treat. So I'm just looking for more options a lot of times. And realistically, I might start a bird on Celebrex because I really want to use something that we know we have some more research on. And I may add in CBD, or if it's not helping, or if somebody says I'd rather try something a little bit more natural, we might start with CBD. So there's no right or wrong way to do it. And making sure the diet is good and trying to reduce stressors and other things that go along with the different presentations. Antibiotics if they need it, motility meds if they need it, right?
Yeah.
Yeah.
Is Celebrex anti-inflammatory type of medication, or what is that doing?
It is. So we think of aspirin and ibuprofen. Those are nonsteroidal anti-inflammatories, and those are called COX-1. They work on a different receptor. Celebrex, robenacoxib, those are COX-2 anti-inflammatories. They work a little bit differently, typically less irritation of the platelets or clotting problems, typically less risk of stomach ulcers. So different receptors, just like with CBD, but also better inflammatory at the nerve and with lymphocytes. So I think that's why that works better than like say meloxicam or aspirin. Yeah.
But it looked like the CBD, one of the big things that did was suppressing the lymphocyte proliferation. So I think that, I mean, if you could use them in combination and really reduce that, I think that, of course, that would be incredibly helpful. I had some questions about just CBD interaction with other medication. Um, one of the things that it seemed like you mentioned was just kind of overwhelming the liver, but does CBD interact directly with the medications themselves? Does it decrease the efficacy of the medications or does it increase it? Or are there any direct interactions there?
Like while it's in the stomach or in the
Yeah,
body,
in the body.
circulating around.
Mhm.
Yeah, I suppose if you're on medication that might bind to that receptor, that it might take up space. Maybe some of the nuances of the receptors are different enough that the two drugs can work synergistically. I don't know if I'm the best person to answer that, so I'm not a pharmacologist, but yes, there are probably potential things that could happen that you would want to pay attention to. Typically, when I'm adding something, I'm not changing what I'm already doing because I want to see if the addition is going to be better or worse, or if before I'm going to change to something, I'm going to kind of wean it off so that I don't have the two drugs confusion, right? So when you're using multiple medications, it helps to sort of take things for a couple, at least 72 hours before you make a change, and then monitor your response, how the body's going to assimilate all that.
Mhm. Great. And we've talked a lot about, because a lot of this research has been done in cats and dogs, and we have more information about how they're reacting to CBD and THC and things like that. Are we able to, is the higher dosage that we're using in birds because they have less CB1 and CB2 receptors? I know you said that the dogs had a lot more of the CB1 receptors, and so that's seems why they're more severely
That's
affected.
a really good question, and I would have to go back and look at some of these, probably the chicken papers, if anybody's done pathology and looking, so the funding has to be there to do some of this, and so, that's why we're a little bit behind some of the other species. But yes, there probably are, and metabolic changes. Now, these were Amazon parrots, two species of Amazon parrots. Can we say that an African gray is going to have the exact same milligram per kilogram versus a budgie versus a macaw? So there probably are going to be nuances. We do know that for certain drugs like itraconazole, African grays are more sensitive to that drug than another species of parrot. So yes, that's a starting point. That's with Amazon parrots, but it is showing that yeah, we're not probably going to be using the same doses among the different groups, and there probably are receptor differences and metabolism differences and all different.
I think that's what happens with a lot of the research is like we have this information about cholesterol in birds, but the study was done on chickens. And so we can extrapolate that information and apply it to cetaceans. But in reality, the way that they're metabolizing and digesting things is going to be a lot different because they're different species of birds. And of course, it gives us a really good starting point, but it'll be interesting to see if there's more research that shows how different parrot species specifically are reacting to these kinds of drugs.
Let's
Let's
make a date 5 years from now. I come back and we see what's happened. We'll do a follow up.
hopefully sooner than that. Let- okay, so we answered our questions about the ABV. Let's see. I think this whole kind of category of questions is all kind of interconnected. We have one person that is using the CBD CBDA from Elvet that we talked about. And one of the problems that they're experiencing with this is it smells very strongly like skunk. They had called the company and then were told that it also doesn't taste very good either. Um, they hadn't given it to their bird yet. They said it sounded like a horrible experience. I think just the idea of administering this, and then they
Yeah,
weren't.
and I've tried it. It is a little bit more bitter than some of the other products that may be a little sweeter or more oily, nutty. And what I was told, and I think it's true, that the products that have that more bitter may have more terpenes. Terpenes are chemicals that have kind of a pine flavor. I guess that's my way of sensing it. That might have a little bit more zzz on your tongue, but that's not a bad thing. That's actually a good thing. But it might affect affect the way your animal takes the product. Now, if it's a duck and you can mix it in some mealworms, probably no problem. But if it's a parrot who's a little bit more discerning, can you mask that with something else? Maybe peanut butter, something that's kind of oily and tastes kind of good. But yeah, so it's not a problem that it's spoiled. It's just the way that they've made that there's more of those, that entourage, full spectrums in there.
And we have to do that a lot by using a food vehicle for medications. I mean, we use a lot of meloxicam and tramadol and all of those things, and those also don't taste wonderful. But doing the nut butter is a really good option. We use like yogurts, coconut yogurt, baby food. Sometimes we do a combination of all of those things to really mask the flavor of that. So I would say you can maybe try some of those different food vehicles and see if any of those are good methods of.
Just like, yeah, people, you know how certain people are super tasters and super sniffers and what might, be really good for somebody like, ugh. I think parrots are that way too. I mean, one of my birds will eat artichoke, which is kind of bitter, and the others will just throw it on the ground. So, why wouldn't parrots have that as well? And some okay with it and some not. Yeah.
Well, in kind of this line of thinking, we've had some people asking about the topical use. Of course, this would be a really great option if you have a bird that is not going to be taking that orally. But I think you mentioned you don't have any good topicals that would work well for birds specifically because they have other things like the menthol and the eucalyptus. There's just no products out there that are unscented or safe for use in birds right now.
Hoping that changes. I do have one product that we just got in that we're going to try, but I think you also have to be careful. That might be more on unbroken skin, like maybe a really dry, itchy bird, as opposed to like a deep ulcer. Because some of these products also have alcohols in them to help them absorb into the skin, and that could sting or cause irritation. So I think this is an area that needs a lot more investigation, and probably the dogs are going to lead the way, and humans, obviously. I'm going to do my best to try with some of our patients in a careful way, and we'll see what happens. But yeah, I think it's really promising and has some good merit.
Yeah. One question that I would have about just the different forms of administration is when you're applying that topically, does it have more benefits in like that specific area that it's being applied? Is that kind of what benefits of?
Yeah, and I've used I think I used a Green Roads menthol based on my shoulder. I tore my shoulder last year, and I was doing a lot of different things, and I was using some topical CBD. And so, yes, I could feel the result there. There are some products that have more of a transdermal and can get absorbed systemically, that could cause systemic effects. So you would want to be careful, especially if you're using it for a dog, because of their unique ways. Or, how do we really dose it then? Because it's topical and we can't measure always. Some of these that have a pump, and you can say, well, how many milligrams per pump? That would be better, because each pump should be measured. Then if you just stick your finger in a container and yeah. So yeah, that's going to be challenging, but not undoable.
Mhm. And this question specifically, this person was asking, I want to administer for feather plucking and mutilation. Can I use it topically? But if they're also administering the CBD orally, are they still going to be able to reap the benefits if they're looking for more like localized treatment for plucking or mutilation?
Yeah, I guess there's a long answer to that too, because feather plucking is so multifactorial in a lot of cases, and so getting to the cause of it is sometimes challenging, or the several causes. And so trying to address nutritional needs, trying to address social needs, all those are important as well, reproductive needs, concurrent infections. So you may find that there is a synergistic use of topical more at the spot where there's more, where I think it's going to be really helpful. And I have two patients right now. One is a bird that has this one focal lesion on the back, just one spot, picks, biopsy, inflammation. This would be a great one to try just on that spot. Another bird, very similar, focal nerve that might be firing. Can we just target that one? Now, you got to make sure you can get it on the bird, right? And treat it. Some spots are hard and some birds are hard to medicate that well. And then also if it's an oil-based product, it could mess the feathers up. So I want to look for a water-based product if we can. Yeah, and actually this product that I have that I just mentioned, I asked them for the profile. They sent me like 30 pages of stuff on this one. So I just looked at that and I was like pretty impressed, that they have gone to that length to do that. So we'll see. Have yet to try that.
Yeah. And we had another question that was, let's see. So this person has an exotic animal rescue and they have a bearded dragon with muscular dystrophy. And they're also about to take in another bearded dragon with severe MBD. Have there been any studies on CBD usage with bearded dragons or other reptiles that you know of?
And that was one of my to-dos that I did not get to done. But I have not come across a lot of them, but I think it's going to be happening. Reptiles is the fastest growing segment of veterinary medicine, and reptile medicine is really exploding. And so, not only on the Western front, but I think on this integrative approach. So I would look for that, and I could do a quick survey and see what I could find, and maybe email you about that. Apologize for that. Because we see a lot of reptiles in our practice too. I have used in some, but I'm using doses that I don't fully understand yet for those guys. Yeah, and their metabolisms are completely different than birds or mammals, right? Yeah, so that one's an even wilder west.
We're getting there. Um, Part of that question, they were asking about the risks associated with CBD. Are there any adverse side effects that you really see with CBD usage or any of the other varietals, the CBDA, CBVC, all of those kinds of things? Have there been any
Yeah,
adverse side effects or I guess like overdosing on it or anything like that that you've seen?
I don't think I've had doses high enough yet to see a lot of that other than sedation. Sometimes maybe a little loose stool because it's an oil base. A lot of these will be oil based, and oils can be a little irritating. Um, Obviously, taste, maybe a little nausea, regurgitation from those terpenes or just from the whole process of taking that. Um, yeah, sedation. It's probably the biggest one, is they just seem very zen. And
I think
so you could
sometimes.
use that to your advantage if you need to sedate a little higher for certain things, but probably not going to be the same as like injectable sedatives, which you can cause more sedation. But
Yeah. Yeah, I think that that is kind of the least bad side effect. Like they might be sedated for a little bit longer period of time, but there's no other major effects that seems like on any of the organ systems that would maybe detract
now,
people.
liver might be one. So for a bearded dragon, one of the things that they are prone to is hepatic lipidosis, especially if they're in really good body condition. They stop eating. A lot of fat mobilizes to their liver, and that could make it hard to metabolize. Another thing that a lot of reptile patients, their doses are often once a day or every other day, as opposed to like twice a day for our other species, just because of the way they're ectotherms. They metabolize slower. So those would be things, maybe to have a chat with your veterinarian, if they're comfortable working with you on that. But yes, I will do my homework and respond back about that for you on studies. And I'm not aware of it.
Wonderful. And if we have any clients or anyone that's watching that is interested in potentially incorporating CBD with their birds or with their other animals, including reptiles, but maybe they don't have a veterinarian that is close to them or able to give this information to them, is your handout something that you or that our clients
Definitely.
take to?
Yeah, feel free. If their veterinarian wants to shoot me an email, they had a specific question, be glad to, give what I know. But yeah, feel free to pass that along. I kind of wrote it for a veterinarian, but there's good stuff in there like how to select, a product, that list that I gave you. If you want to read those parrot papers, you can download those without, they're available. So if you really want to read that study, the Amazon papers,
Awesome.
be fun. If you never read a research paper, give it a try.
Yeah, it's good to read primary sources of the people who are actually doing this research. Sometimes it can take a minute to kind of be able to understand the conclusions that they're coming to, but I recommend everyone read those primary sources. We have a question or a comment that is going back to the topical usage, and I think this was when we were talking about pumping the dosages of if we were using like a topical lotion or something like that. And someone
Yeah.
said,
So go
what
ahead. Yeah.
syringe and oil and therefore control the dose. One thing that I wanted to clarify is a lot of these CBDs are in an oil format, but that doesn't necessarily mean that they could be used for topical use, correct?
You're right. Maybe some of them more than others. Some of them have been designed to be more absorptive. So that's another question I don't have an answer to, but potentially.
Okay.
Pretty oily though, so just be careful of feathers. What I wanted to mention with this one, this is a half ounce and it says, 200 milligrams in a half ounce, and I want to know how many pumps. I got 55 pumps out of this, so now I can tell you specifically how many milligrams are in this each pump. But I think that's kind of what you have to sort of do, as we learn to dose. And if we want to be more scientific about it, um, we kind of have to know those things. So that's when research. So when people say, "Well, there's really no research out there in birds or parrots," well, now you know there is. If people say, "Well, you aren't really giving your animals CBD," well, there is. Well, how much could there really be known? Hopefully, I've shown you that a lot is known. And so, but those are some of the unknowns that we're still trying to figure out. And even drugs that we've known for years in, clinical studies that are approved by the FDA, we're still finding things good and bad over time. So it's an evolving process.
Mhm. Kind of in keeping with some of this administration discussion, do you think that there are other ways to administer beyond topically and orally? One of the things that popped into my head was potentially nebulizing this, but I don't know if that would be effective or safe, or if there's any other methods of administration.
Yes, I'd be careful about oil-based nebulization because you can get a lipid pneumonia when you inhale fat molecules, which could be toxic or fatal. So I would definitely not do that. Um, you could argue, well, if I smoke it or I vape it, and my bird is nearby and getting that, but I still think there's a lot of stuff in the vaping and in the smoking that are more harmful than helpful, if that makes sense. And also, yeah.
Are there
So
other carriers apart from oils that CBD could be in that would potentially be safer options if we're trying to avoid like the pneumonia lipid? Um,
yeah, yeah, I know that there is, for mushroom toxicity, there are some injectable, forms of reversals. So I don't know if anyone's looking at that. That is something I have not. Probably someone will be or is injectable forms, but that would be again really hard to titrate. Probably would be developed for people, THC counteractions, but it's absorbed pretty quickly orally. So especially if there's CBDA in there, under the tongue, you're getting pretty immediate absorption too in a lot of cases.
Interesting. Let's see. All right. Let me see what other questions we have. A lot of it has been about the administration of it and some of the uses. So, one of the questions that I wasn't super sure about or familiar with of PEA, let's see if I can pronounce this, palmitoyethylamide. Are you familiar with what that is?
One of my slides,
Okay.
was it? I don't know. That might be over my pay grade on that one. I'm just a veterinarian. Come on, I'm not a chemist.
If I can find it in the slides here.
Uh,
Oh, oh wait, no, maybe that one's it.
I'm not sure if I remember seeing that where that would have been. Yeah, there's a lot of additional components that some of these products might have to stabilize. So I'm not sure if that was what somebody was talking about, like a stabilizer or a.
Hmm. I can look that up and
Okay.
send a follow-up email if I get more information on that. And then we can send a follow-up email if there are any unanswered questions here. Let's see.
Am I
And
still there?
someone
I
had
just
asked
stopped sharing.
to get the worksheet that we have, and I will email that to everybody just in a follow-up email. So don't worry, I'll send that out after we finish up here. Let's see. We have a very long question. I think that maybe a multi-part question from Julie. Let's see. When one of our customers adopters behavior requests or those who ask for the name of an avian DVM and they ask us if they can just share their hemp or marijuana products with their birds, how do we let them know that this supplement or drug should be used under the care of their veterinarian? Or what is an appropriate answer to clarify with them that the dosages and concentrations are not the same for humans and birds or other animals.
Yeah,
And then
that's a great question.
the possible dangers when they dose the animal bird themselves.
Right, because one, I guess your veterinarian will talk to you about it if it's in a state that's legal. So one, find out what state you're in and what your legalities are. Not that people don't do things that, are not always legal, but that would be great as a first step. Is this legal in my state? Number two, share with them that checklist of how to find a good product. Make sure that product isn't sold, out of somebody's, back door that just sort of threw it together and is hoping that they're doing the right thing. Look for those proofs and those certifications. And the dosing is much different. And other than just saying, well, there's some papers out there in the last couple of years, and there's a lot that we're learning that's different. People won't know until they investigate that.
Yeah, I think that we have some really good resources from you. And I think that we'll recommend this webinar to people as well so they can have a better understanding of the products and kind of what they're looking at as kind of a starting point when they're going in to consult with their
And
veterinarian.
check your state, New York State Veterinary Medical Society. Just Dr. Sosnow just presented like 2 weeks ago, and I took the free 1 hour CE just because I wanted to see for anything different. And so check with your state boards. Your groups may have lectures, conferences that the veterinarians and the technicians go to. I'm sure. I think one of the reasons my notes didn't get published in 2021 is it was still kind of like, ooh, I don't know if we want to get this out there. So. But now I think people are more willing to publish on it and talk about it and not be afraid of it, and understand it better. Yeah.
And let's see, I have another question. Maybe this can be our final one. But being in Colorado, we have a lot of people that consume THC and CBD products. And I have had a client come to me saying that their bird had gotten into some of their edible gummies, and I think had a very similar reaction to what we would see in dogs. They were pretty slumped sitting there. Um, are we able to use CBD in the same way that we would see with the THC toxosis in cats and dogs? Would you similarly administer that
Be
to?
as severe. Yeah, well, THC is definitely going to be more severe effects because it's going to have more of that hallucinogenic effect. Whereas CBD has some of that, but certainly not. And I don't think we need it, honestly. I don't know. I think our animals don't have that cognitive ability to understand, that they're tripping or whatever. So, but I think there's enough effect of the CBD for some of those things that we want to approximate. Um, but yeah, I think so far, it would be really hard to probably die from it other than, um, you know, it had a contaminant and you ate too much and but, as far as I think your body would hopefully metabolize that over time. But I would definitely tell your veterinarian you have your bird on it because it may affect how they treat your bird with other medications or if there's something happening with the liver. Well, maybe we need to back down on the dose or maybe do it once a day instead of twice a day to help spare that liver. Yeah.
In this case, I think it was accidental. I think that
Okay.
these products out and their bird had gotten into them and they were THC gummies.
THC. Yeah. I don't have a lot of experience with that, honestly, but yes, it probably would be very similar effects.
Yeah, would you
Yeah.
have any recommendations if something like that were to happen of should they take their bird into a veterinarian and have them seen to maybe be put on oxygen or something like that? Is there anything that a veterinarian could do in that situation?
I mean, if the bird was stable enough to swallow, you could give CBD, and that would compete with the receptors. I would, if the bird was, asleep or not able to swallow, I would definitely wouldn't do that because they could aspirate. If it's been longer than a couple hours and they, haven't eaten, or they seem dehydrated, they might need some medical attention. So it really depends how bad it is and what's happening with it. But the hope is that they would recover and they would just need some support. But it might have to be in a hospital if it goes, beyond half of a day.
Yeah, that happened somewhat recently. So it was really interesting
Ah,
to learn that CBD can counteract the effects of THC by, is it just they are also binding to those receptors and then
yeah,
it's just,
competing, just displacing it. Yeah,
well, yeah, I think that's really interesting and not something that a lot of people would know. It almost seems like a little counterintuitive of like, oh, I'm going to give them CBD on top of this. But in reality, the way it's working in a biological standpoint, it does make a lot of sense how it works there. Awesome.
yeah.
I think that we covered all of our questions here. Let me just make sure that I didn't miss anything. Oh wait, I missed a big one. Okay, let's see. So this person says they use Green Elements organic hemp oil. It's 400 milligrams for cat and dog, and then they dilute it using a vegan flax oil. The lid says CBD for cats and dogs, and they were confused if they were giving their bird hemp or CBD oil. And on the bottle, it does say full spectrum cannabinoids. They've done research. The product seems like it's well formulated, but they're still just a little bit confused if it is hemp or CBD oil. And I think everyone's
Sounds like it. Yeah, it sounds like yeah. It's hemp CBD, and there should be a label or somewhere it should say percentage of THC, either 0 or less than 0.3. Again, to be legal with the federal, they have to say that. But again, it might be a product that is not at that level. So look for that. And then if it has a little QR code or a number on the bottom that they could find out the ingredients level will say, it'll say how much and what's in there. Um, but the 400 milligrams is that for the whole bottle? Because sometimes what they'll say is 200 milligrams and it's the whole thing. And then what you have to figure out is how many milliliters or ounce convert to milliliters. So you know how many per mill. And sometimes you'll need your veterinarian to help you with that, right? If you're not a pharmacist and you don't know how to do those calculations. And then if you dilute it further with flax oil, which is probably okay, then you're going to have to figure out, well, now what am I giving per mill? Because then it's going to be hard to know what dose you're giving if you want to kind of stay in that more scientific approach.
Yeah. It says, or they had sent more
Oh, they
information.
don't believe in it. Okay. Um,
Was batch and then a total CBD plus cannabinoid milligrams per milliliter. So I think that the number that they have is for the full bottle potentially.
sounds high. There's not too many products that are 400 milligrams per mil. So just double check and just make sure it's not the full bottle. And then you have to figure out how many ounces. But just double check that. Make sure.
And I think that that's the one where you could probably reach out to the manufacturer for
Mhm.
clarification about their products. And they should be happy to give you that information. Let's see. So, yes, it was the whole bottle. Okay, perfect.
Yeah, okay.
Helpless CBD,
Yeah.
they don't believe in it. Really unfortunate. I think looking at how it's working in the body, it's hard to not, I guess, believe in the efficacy of this product when there's so much research that is backing it at this point. Um, but I think you can always get a second opinion. That's always a good option there. Let's see. We had some more follow-up questions here. Does CBD usage show up on CBCs or like a chem panel when you're getting blood work?
Oh, and we don't have a way to measure it as a routine way. Probably there is a way to screen blood, or certainly they can check for marijuana, drug testing. So, but I haven't had birds that have we've done that with. So,
Okay.
yeah.
And then one more question that we can maybe finish up with here is this person is asking, is CBD helpful in aggressive behaviors, negative hormonal changes, etc.? And is a prescription needed? And what are the approximate costs of some of these products that we've talked about today?
Yeah. So I do find that if the aggressive behavior does have some of the bird is painful, the bird is anxious, maybe has a condition where there's inflammation or yes, and that would be helpful. Well, just for cost, like the Elevet product, you can buy that online. I think the cost for a cockatiel would be about $11 a month for a cockatiel dose at about 30 milligrams per kilogram. Um, that's pretty reasonable because it is such high concentration. Some of the other products, if they're lower concentration and maybe you have to use it because the bird will take that one, for a cockatiel at that dose could be anywhere, up to I think like $30 to $40 per month. So significantly different based on the product and your dose. Does that help?
Yeah, I think
Yeah.
the kind of a complex question because, of course, like you mentioned, some of those aggressive behaviors can be maybe exacerbated by an underlying medical condition. It makes
Mhm.
sense if a bird is having nerve pain that they are going to be more irritable and maybe they don't want to be touched. And so you might see lunging or biting or feel fearfulness in relation to some of that pain that they're experiencing. But of course, we don't necessarily know what the cause of these behaviors are unless we're looking at kind of the full environment. We're looking and seeing is there a dietary aspect? Is it an environmental, cage, enrichment, all of these other things. So I think that yes, this would be a really good avenue to explore if you have determined that these behaviors are potentially being caused by underlying medical condition, but it also might be good to speak with a behavioral consultant or just like an avian professional if you're not quite sure what's causing these behaviors and maybe consult with them a little bit and see if this would be a good avenue to explore.
And just a good, if your bird hasn't been to a veterinarian for a while or hasn't had a good medical workup, even if you feel that nothing's really wrong, get a good relationship with a vet, have a good exam, and then follow over time. That way you're going to know, is there anything concurrently? Now maybe some blood work occasionally is done to check for the liver, maybe some behavioral assessment. So it is multifactorial, but start with a good medical clearance, right? Before you can I'm sure the astronauts had a really big one before they went up into the space. And behavioral probably too, because I'm not doing that.
Awesome. Let's see. Oh, yeah, looks like we had someone that was recording. Well, I think that we got through all of our questions. Hopefully, I didn't miss anyone. I'm so sorry if I did. If for whatever reason we didn't answer your question, either I missed it or we didn't answer it in its entirety, you are welcome to email me directly and I can pass on those questions to Laura. Or you said that people are welcome to contact you directly as well. So I will send a follow-up email for everyone that has your contact information and that handout. And yeah, I just want to thank you again for joining us today. This was such a wonderful presentation, and I think it's something that people obviously have a lot of questions about and want to know more about. So yeah, hopefully we'll be able to do that follow-up in a couple of years, and we'll have so much more information and studies with birds specifically.
Thanks, guys. You had a lot of great questions. Thanks for all your attention and having me today.
All right. Well, thank you, everybody. I think we're gonna sign off here. Well, is there anywhere like your social media or anything that you want to promote or where people can find you or anything like that?
Just look up my name or Buffalo Bird Nerd. You'll find me.
Sounds good. Well, thank you so much, everyone. It was so good to see you. All right. Bye,
Thanks,
guys.
guys.